We're going to make it publicly available to everybody to be able to analyze with us. If it shows promise, we will expand access to these products to even more conditions amongst Medicare and Medicaid beneficiaries. I want to thank not just the Secretary, but Marty McCary. We want a lot of companies who are doing this research that approach the FDA for formal approval. That is the right way to move forward. And Jay Bhattacharya, who's hiding in the back, he rarely hides, but Jay runs NIH, and he's agreed to support initiatives to study the data that we're collecting. Howard Kester, God bless you for being a pain in our sides. Mr. President, he's promised to stop calling you. But on this issue, he'll call you on other issues. And I thank you again from the bottom of my heart for taking a difficult stance.
Thank you very much. Okay.
Mr. President, members of the Cabinet, thank you so much for the opportunity to be here and for your leadership in rescheduling cannabis from Schedule 1 to Schedule 3. This decision will accelerate scientific research and expand what can responsibly be studied. I'm a cancer psychiatrist and medical cannabis researcher at the Dana-Farber Cancer Institute. Over the past decade, federal investment in research has helped transform cancer care. People are living longer than ever before. But cancer care is not only about treating the tumor, it's also about addressing the anxiety, the fear, the stress that can come with a diagnosis, symptoms that can interfere with treatment and make recovery much more difficult. Many medications we use for acute anxiety carry significant risks, particularly in the older adults. That's why we're studying specific natural compounds found in cannabis, including the non-addictive cannabidiol, to understand whether they can safely and effectively help manage anxiety during cancer treatment. Rescheduling allows us to ask these questions rigorously about dosing, about safety, and who may benefit most. This research reflects the best of federal investment, helping people not only live longer, but live better. Thank you, Mr. President, for supporting careful, science-based research that puts patients first.
Thank you. Thank you, Doug. That's beautiful. Thank you.
I'll add my vote of thanks, Mr. President. I never really thought this day would come. I met a patient about 20 years ago, a retired professor named Elizabeth, who came to my clinic. She was dying of pancreatic cancer, and she asked me then whether cannabis might help her. And I said no, because that's what I learned in medical school. She reached into her briefcase, took out a 3-inch tall stack of articles, put them down on my desk, and said, "Really, doctor? You should read these. You might learn something." And I did read those articles, every single one, and found a bunch more. And I did learn something. I learned that there actually is some medical benefit to cannabis that I had not anticipated, never heard about in medical school. Second, I learned that there was a lot we don't know. And third, I learned it's really, really, really difficult to do high-quality, randomized controlled trials of a substance that's federally illegal. This rescheduling has the potential to change all of that and to rewrite the way that we do research related to cannabis in the United States in 3 ways. First of all, it'll democratize the research process so that all academic institutions can participate in research, not just elite academic medical centers. Number 2, it'll give patients and researchers access to highly refined, reliable sources of cannabis rather than relying on 1 or 2 sources around the country. And last but not least, it'll let us do the sorts of large-scale randomized controlled trials that we do in oncology and cardiology, not dozens of patients, but hundreds or thousands of patients. That's how we learn, that's how we produce valuable knowledge that's useful in guiding treatment decisions. Mr. President, without you, this never would have been possible, and my patients and I and all of our families are grateful. Thank you.
Thank you, Doctor, very much. Thank you very much.
Mr. President, I am Dan Wiley, National Commander of the American Legion, representing 1.5 million veterans. We are the largest veterans organization. We have 2.5 million members of our American Legion family. And I want to start by thanking you for your leadership on this issue. This issue is extremely important to the American Legion, and I want to thank you on behalf of the veterans who are going to benefit from potentially the research regarding this issue. Also want to thank you for your VA Secretary, Secretary Collins, and his work on difficult veterans issues with us this past year. The VA has worked with us on our Be the One mission, which is a mission to fight the epidemic of veteran suicide. Veterans are disproportionately affected by conditions such as PTSD, TBI, depression, and chronic pain. And with this reclassification, it will allow research to be conducted with regard to cannabis.